Hi, my name's Laura Boyd. I'm Deputy Director of the NHS Innovation Accelerator. We just wanted to say a few words about the NIA because S12, led by Amy, joined the programme last year. And this is just to give that overview. So the NIA is an NHS England initiative delivered in partnership with the 15 academic health science networks across the country. The challenge we seek to address is how can we get great evidence-based innovations demonstrating an impact to improve patient outcomes and reduce cost of the system. How can we get them spread at pace across the NHS, the greater NHS staff and patient benefit? So Amy applied last year, and I'm just going to slightly stress the application process that applicants undertake. The NIA is slightly different from traditional accelerators in that it supports evidence-based mature innovations that are ready for spread across the NHS. So this is beyond the early stage ideas phase that many accelerators address. And what is also different about the NIA is that we look for an excellent individual or a fellow who's willing to share their experiences with spread across the NHS. So not only are we recruiting a fantastic innovation, we're also looking for someone who can spread their learnings and insights so that others, both other innovators and the NHS adopting sites themselves, can benefit from this fellowship. So when applicants apply, they fill in an application form stating why them and why their innovation, what the need is that they're addressing and what evidence they have to show impact. The application is assessed by a minimum of 5 assessors drawn from clinicians, patients, commercial and technical experts from across the NHS and the Academic Health Science Network. They are then shortlisted for interview, and while they're shortlisted, NICE does an informal review of those applications to ensure there's nothing at odds with national policy or direction. At the same time, we invite all the national clinical directors to review those applications. So again, ensuring that they're supported at that senior level at NHS England, and that also there's nothing at odds with national policy or strategy. Applicants are then invited to an interview made up of clinicians, patients, technical and commercial experts. And I think we had the National Clinical Director for Mental Health who also joined Amy's panel in that year. And those scores and feedback from the interview panels are then taken to a final decision-making panel, which is chaired by Professor Stephen Powers, National Medical Director for NHS England. And at that stage, those that are successful are ratified, and they then go on to a due diligence process. So the reason I'm slightly emphasising this application process is just to highlight the rigour and the robust process anyone has to go through to get onto this nationally supported programme. So Amy and S12 have been on the programme since 2019, and you'll have seen in the welcome video Amanda Begley, our National Director, highlighting the simplicity and obviousness of S12, which makes it such a fantastic innovation and why it's so important. While fellows and their innovations are on the NIA, we provide all the support necessary to try and get their innovations spread more widely across the NHS. We work very closely with NHS England so that innovations are hopefully at the forefront of their minds, and in our work to support COVID-19, the pandemic and reset, we have been highlighting how the innovations are meeting some of the challenges that the pandemic has highlighted. The other thing to say is our next call for applications launches in September. Mental health will then again be a theme, along with workforce and COVID-19 reset. Very happy to take questions at the end of this. Thank you.